Cardiopulmonary Resuscitation CPR in detail. How to save a person's life when their heart or breathing stops. Connecticut balloon. Cardiopulmonary resuscitation CPR is an emergency procedure aimed at restoring blood and oxygen flow to the brain and heart when the heart stops beating or a person stops breathing. This procedure is one of the most important life-saving interventions, and everyone should learn it, as it could be the difference between life and death in emergencies. Step 1. Ensure the scene is safe and check for responsiveness. 1.1. Check the safety of the area before starting any action. Make sure the area is safe for you and the injured person. Avoid risks, such as moving traffic, smoke, exposed electricity, or any other danger that might threaten your life while performing first aid. 1.2. Check the person's responsiveness. Approach the injured person and kneel beside them. Call out loudly, "Can you hear me? Are you okay?" If there is no response, try to stimulate them gently by shaking their shoulder. If there is still no response, move on to the next step. 1.3. Call for help. Ask someone nearby to call emergency services, 911 or your country's emergency number. If you are alone, call for help first before starting first aid. If an automated external defibrillator, AED, is available, ask someone to bring it immediately. Step 2. Check for breathing and airway. 2.1. Open the airway. Lay the person flat on their back on a hard, level surface. Place one hand on their forehead, then tilt their head back and lift their chin with the other hand. This action helps open the airway and prevents the tongue from blocking it. 2.2. Check for breathing. Look for chest movement. Listen for breath sounds by placing your ear near their mouth. Try to feel for air coming out of their nose or mouth. Continue the check for no more than 10 seconds. 2.3. Decide what to do. If the person is breathing normally, place them in the recovery position and wait for help. If there is no breathing, or if breathing is abnormal, like gasping or irregular breathing, immediately move on to the next step and start CPR. Step 3. Perform chest compressions. 3.1. Position your hands. Kneel beside the person and place the heel of one hand on the center of their chest, just above the sternum. Place your other hand on top and interlock your fingers. Ensure your arms are straight and use your upper body weight to compress, not just your arms. 3.2. Perform chest compressions. Press down firmly and quickly to a depth of 2.5 inches, 5.6 cm. Allow the chest to return to its normal position between compressions. Maintain a compression rate of 1, 0, 0, 1, 2, 0 compressions per minute, about 1 compression every half second. Step 4. Provide rescue breaths. If you are trained to do so. 4.1. Prepare for rescue breaths. After 30 chest compressions, open the airway again. Pinch the person's nose closed using your fingers and tilt their head back slightly. Open their mouth slightly. 4.2. Perform rescue breaths. Cover their mouth with yours to create a seal and gently blow air into their mouth until you see their chest rise. Each breath should last about 1 second. Give 2 breaths, then immediately return to chest compressions. 4.3. Check for effectiveness. If their chest does not rise with the first breath, check the airway to ensure it is open. Then try again. If the person still does not respond after 2 rescue breaths, continue with chest compressions without pausing. Step 5. Continue until help arrives. Continue cycles of 30 chest compressions and 2 rescue breaths. Do not stop unless the person begins to breathe normally. Emergency medical help arrives. You are too exhausted to continue.